Hi, welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. I want to thank all my listeners, both on YouTube and on my podcast channels, for not only subscribing, but also sharing the information that I have given you on all different topics related to wellness and plastic surgery. Today, let's talk about revision rhinoplasty. It's completely different than a primary rhinoplasty, and how you can prevent and manage the revision rhinoplasty patient. And even if you're a rhinoplasty patient, what goes on and how can you manage that? So why do primary rhinoplasties fail? I think that's a very important question. And I think the biggest thing is consistency. I think consistency in your approach, consistency in patient selection, consistency in feedback, and most importantly, don't do crazy stuff. I think that's really, really important. And consistency also helps you develop, you can see the end result before you start. So once you can do that, you have become a consistent, reproducible expert. And you never leave the operating room until it looks as great as it can be. And always, always look at your results. Because remember, the eye only sees what the mind knows. So when I envision a patient like this, I know what the nose is going to look like before I start the operation, because I've talked to the patient about their top 3 concerns. So you want to be the best you can be. So you have to be the best, you have to train with the best. And I certainly trained with some amazing masters of rhinoplasty, from Dr. Gunter and Dr. Sheen and others. And then you have to fail and learn from your failures before you succeed and get better. But consistency is very important. Consistently getting good results to great results is very, very important. And that's based upon 5 things: your analysis, your preparation of your patient, your execution of the operation, you're delivering the best you can be, and then follow-up, experience, and self-analysis. Those are all very important. From the primary rhinoplasty patient, what did you learn in 13 years follow-up on how the patient looks? Does it look natural? To the revision rhinoplasty patient, to how they look, and what functional and aesthetic concerns did you address? To long-term results. You see a patient at 3, 5, 12, 25 years. What does that patient look like? Does the patient's nose still look shapely and shape and contour? Does it adhere and look like it's really good? And I think the answer to this in this case is that this patient aged well with her nose. And then you have to fail. When you fail, you will not always be successful, but you must learn from those failures, and then you can become better. And what are the 3 reasons that primary rhinoplasty fails? It's because we didn't do a good job in selecting the patients, and you didn't match the patient's expectations to the procedure. Inadequate framework or skin envelope. And then the last thing is dead space, and I'll talk a little bit about that in layman's terms. And I think the biggest thing is you have to tell revision rhinoplasty patients the things you can't do. In a rhinoplasty, you tell them the 3 things you can do, but in revision, so many times you can tell them there's things it'll never be straight, the tip will never be completely soft, it'll be straighter, better, and then sometimes if they've had 4 or 5 rhinoplasties, you can say there'll only be an incremental improvement, and it may take 2, 3 years. And you need to manage these patients' expectations preoperatively, and you need to be honest with them, because sometimes you have to say no. And honestly, if they're unhappy or they're a smoker, if you don't have a good vibe with them, don't operate on them. I think that's very important. But be very systematic, be algorithmic. Never leave till it looks as perfect as it can be, and then don't do crazy things. And the most important thing in patient selection is the patient, are you reasonable, rational, ready, and are you reliably going to follow the post-op instructions? Because it's a partnership between the surgeon and the patient to make sure that you get the best results. So I will be an active listener. I will try not to operate on a body dysmorphic patient or a narcissistic patient, or on patients that are angry at their other surgeons or unhappy about life. I think that's, I can't help that. I mean, my goal is to help them improve their nasal function and their appearance somewhat. But it'll never be perfect. I've never done a perfect rhinoplasty. No one has. Imaging is very key. I think that I will show images to patients of what I can and cannot do, and I think you need to underpromise and overdeliver. List the top 3 concerns and fix them, and then have some sense of what you can and cannot do. It will never be perfect. show average computer images. And then you can tell them things that you can do and the 3 things you can't do. And that wound healing takes a long time, 2-3 years, especially in revision rhinoplasty patients. But it will never be perfect, but or be back to where it was originally. Sometimes I have patients bring me photos of what they looked like before their first rhinoplasty, and they've had 5. It's just not going to happen. So show them average imaging results of revision. I think that's really important to show them imaging results and then the post-op, just to give you an idea of what's possible and what's not possible. I think that's really important because then they can see what you can deliver and what you can't. And then it comes down to the surgery, the framework and the skin envelope, redraping. You know, you have to restore the framework and then the skin envelope. That's really important. You have to push it up and push it down. And this is obviously not a lesson in rhinoplasty, but it just shows you what a typical nose will look like when you open it, and you can see the big scar tissue. And so what you do is you want to take the tissue, you want to have imagery of what it can look like, and then you want to do the goal of what it really does look like after you've put in rib grafts and shaped it and contoured it. And then you can actually get the result, you know, using different types of techniques, and then grafts and sutures and things like that to give you a reasonably good result. Like you see in this patient, nice straight dorsal aesthetic lines, tip shaping is much improved. And she's still going to look better in another year because she's got thick skin. She now looks elegant and beautiful, but her tip and dorsum is still going to be more refined as time goes on. And I think that's the beauty of revision rhinoplasty. So you can see that and have that happen all the time. And then the last thing is, the most unpredictable is wound healing. And, you know, 90% of how you heal is really your own destiny. And this is a patient that has had, I think, 4 or 5 previous rhinoplasties, and just shows her post-op at about 2 weeks, and she couldn't breathe through her nose. It was very deviated. We had to reconstruct her entire dorsum, her tip. You can see, you know, she now has a straighter dorsum and tip. And, you know, she was agonized because she couldn't breathe, and it was very, very deformed both externally and internally, and it was foreshortened. So I lengthened the nose with a rib graft. I shaped it and restored it. And really, she came in almost crying because of how, not only how good it looked, but how she could breathe through her nose. You can see she's very deviated here, and we brought the pyramid back and made it straight. And so it's straight, and it looks really, really nice. And I think that's really what you want to do in these patients. You want to make sure that they look good. And so here she is in her static photos, straighter nose, shapelier, much more improved contour. And I think that's really very, very shapely and contour. And this is an early result, but just show you how dramatic these changes can be in reshaping and restoring a foreshortened nose. And that's all about dead space closure. And it's the most unpredictable thing you can do. And this is really, you have to do things that make it predictable. And there's things you can do, and there's just an example of a patient that had these challenges of having 6 previous rhinoplasties, a lot of tissue fibrosis, a lot of foreign bodies, foreshortened nose. And of course, these are things where this is an extreme case where you had to take out foreign bodies, silicone, do augmentation, rib graft, and remove implants, and remove the scar tissue, reshape the dorsum, do all these things in these patients. Here she is at 10 days, and here she is at 11 months. And you know, you can see her nose is shaping. She now actually can breathe. Her nose has been elongated, and you can see now that she's actually looks much more normal. And of course, here she is at 3 years. She's actually gotten married, and she's no longer being shunned in her community, and she looks beautiful. And she's got a beautiful shape and contour of her dorsum and tip. Is it perfect? Of course not, but it is straighter, better, and she can breathe. And I think that's really what you want. You want to get a patient where you can do dead space management closure like we talked about here, which is basically hemostasis, use of dead space closure techniques and technology so that you can really get and do the right things. So in summary, the most important thing is an informed patient, doing the best you can be, a graduated approach, and get constant feedback on what what you can do to make what you do better, and don't do crazy stuff, and follow your patients long term. Hopefully this will help you understand the power and the complexity of revision rhinoplasty, which is the hardest procedure we do in all of plastic surgery, because it's a surgery not only of millimeters, but also of tincture of time. It takes, years and years to see the final result, and it also takes decades to become a rhinoplasty expert, especially in the revision rhinoplasty. And not all patients that have had a significant nasal deformity really can be successfully treated with rhinoplasty. But remember, our goal is to help the patient become the best they can be in their part of that journey with us. So leave us your comments, leave us your thoughts, and helping you become a better you.